Hi and welcome for that reminder on specific stretches around the lower back and the hips. So if you have lower back pain or just want to keep some maintenance around your hips, we will see that right now. So principles can be passive, active, muscle energy. The major muscles we will speak about around the hips and lower back on the number 3. The adductors, so to the groin muscles to bring the legs in. The lateral muscles, abductors, medius glute piriformis, and the psoas, hip flexor. What brings the hip on the chest, but it's also the major stability around the lower back and the hips. You can stretch whatever muscles you want, no problem with that, but these 3 muscles are really the most important about the stability. Adductors, groins, have to be stretches before the other muscles, and muscles have also often to be strengthened, like the glutes, because if they're not strong enough they will get tight too fast, too early, so it's a little bit a vicious circle. The hip flexors, don't strengthen them, they're always contracted. They act also with the digestive system, they act when we breathe, they are always in tension, so no need to strengthen them apart. Groins, never strengthen them, they're really passive muscles. They have insertions under the pelvic bone. Core has insertion on top of the pelvic bone, so if the core is not strong enough compared to the groins will pull to the pelvic bone, and that will give an inflammation, tendinitis, pubalgia, what it's named, what soccer players, hockey players know well. Very difficult to get rid of and painful. The sequence to do that is always to start with the groins, then hip flexors, and then only we go on the glutes. Principle about it is, first, if the muscles are contracted, the groins, it will give tightness around the inguinal area. And another principle in osteopathy is always to go through the barrier of the groin before to stretch the hip flexors. So for the groin, the position we will use will be to lie on your back, knees bent, and we do the butterfly stretch. So just simply let the legs going on the side, keep them for 30 seconds, a minute. If you want, you can ask an active part, put a resistance to avoid to squeeze a few seconds, and then let them passively down. It's a little help to increase the range of motion on the stretch. Then we go right on the hip flexor. So if you want to do it passive, up to you. So if you belong to the Cirque du Soleil, you can try. You take your foot in your bag and you pull it over your shoulder. If you are the other 99.99% of the population, we use the principle of contracting very strongly a muscle for 5-6 seconds and then relieve, and that deep contraction will make that the muscle will actively be relieved and stretched. So the position, if we want to work on the left one, strengthen your left leg, Bend the right one, pull the knee up to your chest as far as possible. In that position, you lift the left leg about 10 centimeters from the floor with a little external rotation. That gives a contraction of that psoas muscle. So it's not here, that is a quad. We want really to stretch the psoas. Then after 6 seconds you let it down, you pull a little bit more the knee. Do that about 3 times, repeat the sequence and change the side, of course, always for hip flexor stretch. Then we go on the glutes. You can, if you do yoga, use the pigeon position. Everybody has its specific position to feel it the most. On the back, the idea is to grab your knee, bend again, and to pull it, but to the opposite shoulder. Very important. That gives a session on the lateral side. So I show it on the right side so you see better. Depending the angle you pull, you will stretch mainly on the glutes, mainly on the hip flexor, where you need to feel it the most. 4 or 5 seconds if you want just to wake up your muscle, 30 seconds to 1 minute, mainly the end of the day, if you want to give a relief to that muscle. So just to do a little recap, all that is for functional reasons, specifically actually. Don't forget the sequence: adductors, then hip flexor, then medius glutes. The principles, the tension, relief, etc. It's not exclusive. You can stretch whatever you want to stretch. You can strengthen whatever you want to. And it's often a good idea to accumulate both: stretching, contraction, strengthening. Never forget the cardio. That's one of the principles of health, to stay active, and cardio goes with activity. And always on a strong core. Core is the most important there. So thank you to everybody, and see you later.